Hi there, and welcome to Tinnitus Tuesday. This week, I want to talk to you about some of the most common causes of tinnitus that I see here in the clinic. Again, I'm Dr. Morehouse, audiologist and owner of Tinnitus Relief Plus Advanced Audiology Center here in Cincinnati. So, let's get into some of the most common causes of tinnitus that I see on a day to day basis. The most common cause that I see here in the office is generally noise exposure. So that could be patients who work in loud environments like in construction, law enforcement, firefighters, dentists, musicians, or those that maybe have noisy hobbies. Maybe you like to go to concerts or you like to use power tools while you're doing woodworking. Any of those things can certainly cause damage to our ears from noise, and I would say it is the number one cause of tinnitus. The second most common that I see here in the office is hearing loss. So, this ranges from the patient who has a significant hearing loss and they know that they're struggling and they really have a hard time getting through their day to day life because of their hearing loss, all the way up to the patient who feels that their hearing is normal, but maybe they have been exposed to noise in the past, or we've had a slight change in our hearing, even though our hearing is still really good, it can change slightly, and that can cause tinnitus. A lot of times, tinnitus is kind of that initial symptom that's warning us that something else is going on and changes are happening. Another common cause that I see here in the office would be ear infections or blockages in the ear canal. So, let's say you've had a recent cold, you developed an ear infection. This is generally temporary though. So, once you get treated with antibiotics and your ear infection clears up, the tinnitus should resolve as well. With blockages in the ear canal, whether that be an outer ear infection like a fungal infection or wax buildup, once that's been taken care of and the wax is removed, then your tinnitus should resolve as well. That should be a temporary form of tinnitus. Medications are another common cause. So there are certain antibiotics that can cause some damage to the ear and our hearing, which could then cause tinnitus. Certain blood pressure medications and certain pain relievers can cause tinnitus as well. So if you're experiencing a sudden change in your hearing or tinnitus after starting a new medication, I would certainly talk to your doctor about that to see if it could be causing your tinnitus. Head and neck injuries are another big one. The trauma from either falling, potentially being in a car accident, things like that can cause a lot of stress and inflammation to the body in our head and neck area. And that is another common cause of tinnitus that we see here. And lastly, and probably the most important, stress and anxiety. Maybe you're starting a new job, or maybe you're about to move, your children are getting ready to go off to college, or maybe you're just starting your family. It doesn't matter where you are in life. If you are experiencing stress and anxiety and noticing tinnitus coming on, there's absolutely things that we can do to help with that and help to manage your stress, anxiety, and the tinnitus. So I hope you guys have found this helpful and interesting. If you have any questions, you can always just drop them in the comments or give our office a call. And I will see you guys on Tuesday.